All right, now Mr. Knox, I'd like to just kind of summarize everything that we've gone over today. So it looks like we're dealing with some bilateral, which is both sides, low back pain. You rated a 6 out of 10 on the pain scale. Started about 6 months ago with no trauma causing it, and the pain kind of goes to your glutes, more on the right side. It doesn't go past the glutes. So it looks like you have more pain on extension. Some things you've been doing to relieve this pain have been to sit with poor posture, kind of flexed over, and then having your knees flexed when you're laying on your back. You've tried NSAIDs, and apparently they didn't see anything on x-ray. You're having your hypertension seen by a PCP that's been treated, and you've been telling me you have some GI issues that have accompanied the low back pain. Some of your biggest concerns are that if you become more active, that this pain will get worse, and it will further stop you, and you're anxious about it because it'll further stop you from your daily life, your work capabilities, and throwing the ball with your son, which is an honest concern. So when focusing on that concern right there, I'd like to try to help you understand that movement is good, motion is good. We don't want to be avoiding motion. We don't want to be, they call it like fear avoidance of motion. We can help find you ways to move that will allow your body to continue moving without recreating the symptoms, causing the pain to get worse. Just like you said, like you're aware that sitting postured over is not good for you, but at least it relieves the pain. We're going to find more ways like that at least won't hurt you more. And this anxiety and stress, hopefully you know that anxiety and stress can affect pain thresholds and treatment recovery time negatively. So I want to kind of avoid that and start looking at our positive outlooks, like what can we do, what can we work with. When it comes to the condition, I'm actually a little deterred right now. I would like to order some lab tests, and for whoever's watching the video, we do like HLA-B27, but that's for whoever the doctor's listening. Whereas for you, Mr. Knox, would like to do some lab work and see if it's not ankylosing spondylitis or enteropathic arthritis, something like that. I know those are scary words, but they just mean kind of inflammation of the joints due to whatever condition. We're not going to call it that yet because we don't have the lab test. So right now what we're going to work with as a working diagnosis will be lumbar facet syndrome. This is common in facet syndrome. They all kind of can present similar, but you have pain on extension, kind of refers to the glutes. Don't know any like major trauma that caused it. So that's kind of what we'll work with right now. And the two exercises that we're going to be working with are exercises that can actually be helpful for ankylosing spondylitis and enteropathic arthritis, with a major focus on the facet syndrome. So what we're going to be doing is implementing flexion-based exercises and core strengthening exercises to relieve pressure from those facet joints. I don't know if I've explained what facet syndrome is yet, but between the joints of your spine, you have these joints which are called facet joints, and they have a capsule. Whenever stuck in, whether it's stuck or whether it's some mild trauma that's caused it or micro traumas, what that'll do is that'll cause irritation and pain from the facet joints, and it'll cause an inflammation in the facet joints, creating more pain, which will have muscle spasms and can accumulate with the radiating pain down to the glutes. The first exercise that we're focused on will be the knee to chest exercise with posterior pelvic tilt. You're going to be doing this 3 sets, 12 reps, I think 3 times a week. Be on your back. And I don't know if you can see too well, but if you can external cue, I'd like you to push your low back into the floor. If you have your hand on your low back, push your back against your hand. That'll rotate your pelvis into the posterior pelvic tilt that we need. We're going to do that. Push it, posterior pelvic tilt, take a knee, hold it up here for 5 seconds with the posterior pelvic tilt. Then release the tilt, take the tilt, and do it with the opposite leg. Good. You're going to do that, you're going to try to maintain neutral spine, neutral pelvis, just rotate it back. We want to push the low back, we want to What that's doing is taking your low back, which would be bent like kind of, I wish I could do it better, like this. We're taking it from here to a little more here, relieving some of the pressure that's on those facet joints. And then the second exercise will be called dead bug. Same amount of reps, sets, 3 sets, 12 reps, 3 times a week. That one, might have to do kind of like this. Okay, can the camera see me? I hope. You're gonna take your arm up here, knees bent, spine, pelvis neutral, head neutral. You're going to take one arm and the opposite leg and extend them out just above the ground, and then bring them up slow. Do it with the opposite arm. There's a bed in the way, but you get the gesture. You gonna do that? That's focusing on strengthening the core, doesn't put a lot of load on the spine, so it's a good exercise for this condition. If you have any more questions, Mr. Knox, please let me know. And man.